If people are willing to put themselves on these like extreme waiting lists,
and half of trans people will at some point go private.
or to fundraise thousands of pounds,
Because the waiting is unbearable.
The sadness of that.
That's not care, is it, of any description? That's just a holding cell.
People struggling with gender dysphoria face NHS waiting times of up to 7 years, according to the latest data. The NHS say this is due to a rise in referrals and commissioning difficulties. Having self-funded my own transition, I'm following other trans youth who are beginning their gender journey. Elio came out as trans 2 years ago. He's currently waiting to begin his medical transition and is hoping to take male hormones and later have chest surgery.
I feel like what I'm presenting physically isn't representative of like my inside. Being on testosterone, I'm hoping that will give me a deeper voice, maybe some facial hair. I can't be shirtless for any amount of time without feeling like somewhat uncomfortable with the fact that I have breasts, and I want to kind of be able to feel more comfortable in my own skin. I'd love to be able to just get out of the shower and wrap a towel around my waist without having to feel this kind of sense of shame and that something isn't right about myself.
But Elio has been told he faces a 5 to 7 year waiting list for a first NHS appointment. So he's turned to the Norwich Trans fundraiser, an upcoming drag show. The event is one of an increasing number of nightlife gigs, raising money to cover medical costs for trans people.
This isn't a new thing entirely, actually. There's a much sort of longer trajectory of fundraisers happening within nightlife contexts. But at the moment, yeah, we're seeing an increase in fundraisers for trans healthcare specifically, and that's coming for, quite obvious reasons in terms of a really chronic underfunding of healthcare services for trans people. And, we also need to remember that often, trans people experience housing discrimination and employment discrimination, and there are these different factors that also shape the capacities of people to access healthcare, private healthcare, if that's something that that they need to.
People coming out these days quickly realise that this isn't going to be available for me unless I go private.
So what would a typical pathway to accessing gender-affirming care look like?
So someone would go to their GP. Hopefully their GP would refer them to an NHS gender clinic. Waiting times are very long, so you'd expect someone that's being seen today by an NHS gender clinic will have waited around 5 years. And it's here again, a lot of people go private, a lot of people will crowdfund or go overseas. People get into debt to go privately or sell the house because the waiting is unbearable for such a lot of people.
Both Elio and Che say that their delay in accessing gender-affirming care had a significant impact on their mental health.
So when I was waiting for top surgery, I could barely shower. Because I could barely shower, I could barely leave the house. Had my mirrors covered up, apart from a little bit at the top where I could see my face.
It does get difficult, and part of the reason why I wanted to start fundraising was because I just thought the length of time that I'm going to be expected to wait, and really the uncertainty of not knowing how long the wait is genuinely going to be, because there's no way to track these things. That kind of thing really does affect your mental health, and it has mine. That's definitely one of the biggest reasons that I've decided to start fundraising, because the kind of wait can be really painful.
Dr. Cathy McKay is a researcher at the Tavistock Gender Clinic, investigating how waiting times are impacting well-being.
There are sort of higher rates of anxiety, higher rates of depression. There's a vulnerability amongst gender questioning young people. But the young people who'd been on the list for sort of a more significant amount of time, 2-3 years, where they'd not heard anything, there was a real sense of not being able to see a future self as someone who is happy and thriving or doing well, just existing. One of the mothers I remember told me that she saw the distress her child was in, and she was so worried because she said, well, my child is so distressed now. How do they grow up to be a happy adult? What does that look like? And I think, again, that goes to the stuckness as well. It's that idea of being seen so you don't feel stuck.
For some of those on the waiting list, the combination of mental distress and uncertainty for their future can be too much to bear.
I'm Caroline Lippman. I'm the mother of Alice Lippman, who died in May 2022. She took her own life. Alice came out as trans in 2019 after her first suicide attempt. There's just a real systemic lack of understanding of trans healthcare in the NHS. And then, of course, the wait list was devastating. And although we were able to seek private hormone therapy, this was overseas, it wasn't well supervised, it wasn't really working, but eventually, not long before Alice died, actually, we were talking to her about getting private surgical intervention, because that is what she ultimately wanted. And then she discovered that the private waitlist had also got incredibly long because of the knock-on effect of the waitlist from the NHS. So she felt very despondent when she found that out not long before she died. Well, she was on the waitlist for 1,023 days, but if she was still alive today, she still wouldn't have been seen. That's not care, is it, of any description? It's just a holding cell. So the key takeaway from the inquest was that Alice's death was preventable and that the waitlist had contributed to her death. I think our main campaign is to raise awareness of the waitlist and to reduce the waitlist and to improve access to healthcare for trans people. And hopefully she'd be proud of me. I think she would be proud of me, and obviously I would rather have her back in a heartbeat, but if I can do anything to help other families like mine and to help other children like Alice, then that's what drives me. Yeah.
Research by Stonewall shows that up to 45% of trans youth have attempted suicide. The desperation of trans patients to seek care is clear. But equally moving is the care the community have for each other. In Norwich, drag performers have travelled for miles to support the fundraising night for Elio.
It's so good to know that you have that community that are willing to be there for you and kind of like willing to say, like, I've got your back, we'll do this together.
Liv is the drag queen organising the event.
We do the show and we do think, why are we doing this? We shouldn't have to do this. And that's that uncomfortable element. But if we don't do this, people wait longer and people suffer. And then I hope one day we don't have to do this show and that it just takes care of itself because it's funded.
The NHS and the Department for Health and Social Care were approached for comment about the medical and mental health difficulties trans people face, but they did not respond. An independent government report examining claims of a rise in trans suicides on waiting lists found that the deaths could happen at all stages of transition and can't be attributed to a single cause. Meanwhile, the fundraiser has given Elio the boost he needs to begin his medical transition.
At the event, they did say that, like, from ticket sales, they already raised over £900, which is, like, incredible. One of the things that I'm hoping to do at the moment is I'm looking to set up an account with a private gender clinic. I'd like to be onto, like, within the next year. That would be, like, the ideal. And then I've also started, like, putting out feelers to find, like, clinics for, like, top surgery.
Elio is just one of many trans people facing the same desperate choices I did, including years-long waiting lists that risk tragic outcomes. Barriers remain, but for trans people and their families, the freedom to live as themselves is a future worth fighting for.
When I went to Brighton the first time after Alice died, we picked up a pebble and I brought it back. And I picked up this one and I turned it over and it had that on it. Isn't that amazing? And I Googled later how many pebbles are there on Brighton Beach? And I can't remember the answer, but it was either 10 or 100 billion. And Alice sent me that one. So I don't believe in all that kind of mumbo jumbo really, but it's pretty special, isn't it?